in girls, basically before age 8, you shouldn't really have much in the way of true puberty. Look for, subtle signs. In girls, I think it's easier because at some point you might see some breast tissue. And if you're worried about it, get it looked at, especially if it's prior to age 8. If a kid is of like a bigger build or carrying a little bit of excess fat tissue, it can actually be very hard to tell what's the difference between what we call lipomastia, which is just a little extra fatty tissue in that area, versus true puberty. But you can always have it looked at, and then the provider can then look for other signs and see whether there's a concern or not. In boys, it can be really difficult, but I would say if you are noticing like early acne, significant amount of acne or like body hair or something like that, it's always a good idea to bring it up, because I think it's not something you're going to want to excavate on your own at home to check out their testicular volume. But if it were happening early, you would want to know about that.
Knowing what you'd mentioned. So just say a family they notice breast buds in their 8-year-old, and they come into the pediatrician and there's no other signs, right? Meaning this is obviously, let's say a female, there's no pubic hair and the height growth is looking good. Is there anything that needs to be done at that point for just, the start of some breast buds?
8 is a perfectly normal time to have breast buds. And to be fair, there has been a shift in the timing of breast buds, even in recent years, to be a little bit younger. So if mom didn't remember getting them until she was 10 and her daughter's getting them at 8, it's probably, normal, because again, 8 is kind of like the lower limit of normal. And again, we see a lot even before that may be considered normal as well. So generally, there wouldn't be anything to do other than to have a discussion with the family about how long this should take to progress. Because I think that what's embedded in the fear when they bring them is not, oh my gosh, my 8-year-old has breast buds, but oh my gosh, my 8-year-old's turning into a woman tomorrow, is going to stop growing in 2 inches from her current height, and is going to get her period on Wednesday.
Welcome back to the show. It is Dr. Mona, your favorite online pediatrician, mom, and here with another amazing guest today, Dr. Sarah Hart Unger. She is a pediatric endocrinologist, writer, and podcast host herself of the Best Laid Plans podcast, which, by the way, has nothing to do with medicine, but you should check it out, and we'll get into that later. But she's joining me. She's a returning guest, and she's talking about early puberty in kids, causes, endocrine disruptors, and what's actually true. Thank you for coming back on the show today, Sarah.
Thank you so much for having me. I'm excited to be back.
Well, we were chit-chatting for like an hour before actually recording about other life stuff. I love chatting with Sarah. She was on the show now 3 years ago, right?
Something like that, yes.
We talked about height in kids. The title of that episode was I Wish My Kid Was a Little Bit Taller, like that song from, I forget who sang it, from the 80s or 90s. But we talked about growth. We talked about when to be concerned. And now we're talking about puberty. But before we get into it, tell our listeners who are not familiar with who you are a little bit more about yourself, what you do as a pediatric endocrinologist, and maybe even more about your podcast.
Sure. So my name is Sarah Hart Unger. I practice pediatric endocrinology in South Florida, and I have been in practice over 10 years now, not counting all of my training. So I feel like I'm in that sort of seasoned place in my career. And I am a part-time practitioner because I have this love for sharing about planning and helping women kind of make the various parts of their lives fit together. So basically 3 days a week I see patients, and then 2 days a week I do stuff related to, I'm actually part of 2 podcasts, Best Laid Plans, and then I have another one on making work and life fit together called Best of Both Worlds, which I co-host with time management expert Laura Vanderkam. And then I have 3 kids. Speaking of puberty, I have a 13-year-old, an 11-year-old, and a 7-year-old, and I'm married to a vascular surgeon. So lots of moving parts.
Yes, and a lot of connection. So I don't know if you all know this. So I'm also in South Florida, which you probably should know. People don't think I live here, but I don't know why. But I know Dr. Sarah from obviously working as a general pediatrician. She's a pediatric endocrinologist. We were at the same hospital at some point. And so we have that connection. And so there's not only a professional one, there's a personal one as well, being in the same area. And so really happy to have you back on. And this was a conversation that I really wanted to have, mainly because there's been a lot of news stories about early puberty, like, on mainstream media talking about kids in America are having puberty earlier than ever. But then I was also seeing a lot of social media videos with moms, especially talking about how and what they're doing to delay their kids' puberty. And it was almost like a catchy gimmick, like, to get people's attention on like what they're avoiding, what they're doing it with diet. And I wanted to get an expert on to talk about what is actually causing early puberty and if there's anything we can avoid or can do to delay that to the normal level, because it sounds like a lot of that videos are like, I'm delaying it until they're 14, 15. Like it's this flex that, oh, I don't want my kid to have it early, but we have to also understand that development is development. So the first question I have, whether it's breast budding in 6-year-olds or pubic hair in grade schoolers, this early puberty concern is there and it's valid. It's all over parenting forums. But what is hype and what's real? And how is early puberty defined? Would be the first question I
Yes.
have for you.
What is early and what is actually normal? So that's a great question. And I will say, I do understand and empathize with people who feel like puberty is a little bit scary. I think maybe this conversation will help you to feel a little bit better about it because I think there are certain things, certain myths out there. One being that the minute you see one sign of puberty, your kid is going to like have their period tomorrow or have a voice change and be done growing in 3 days or something like that. That this process is just this instantaneous, once it starts going downhill kind of a thing. And yet it is so much more nuanced than that. So let's begin by talking about what is actually normal. So in girls, basically before age 8, you shouldn't really have much in the way of true puberty. And I say true puberty because there is a distinction here. There is puberty that comes from the brain and
Mhm.
then stimulates either the ovaries in girls or the testicles in boys to make estrogen in girls and testosterone in boys. And in reality, everyone does make a little bit of both, but we're just going to keep things simple for today. So, the true puberty is the brain giving these hormones called LH and FSH to stimulate those gonads, the ovaries or testes, to make hormone. That's going to cause breast development in girls and it's going to cause testicular enlargement in boys. And let me tell you, usually by the age that we're talking about this, the kids are not really showing you those parts necessarily. So it
Yeah.
can go a little bit under the radar, which is interesting. There's also other signs which can be part of true puberty, like what I just talked about, but can also be part of something called adrenarche, which doesn't get talked about as much. And adrenarche is the process of the adrenal glands, which are two glands that sit on top of the kidneys, kind of waking up and starting to make some hormone of their own. And the interesting things are, you can't really tell the difference between the things that are part of adrenarche and then the things that testosterone does because they're a
Mhm.
little bit similar. They can cause acne to start, just like a few little pimples. They can start some body hair to grow, especially under the arms or in the pubic region. And they can start with some body odor. Adrenarche can begin a couple years before puberty and be normal. So, a lot of times someone will get really, really nervous because their 6 or 7-year-old is starting to get a little stinky when they're sweaty.
Mm.
That's probably not the start of true puberty and is more likely going to be just normal adrenarche, unless there are other concerning things that we'll talk about. But again, going back to what is normal would be if we're talking about signs of true puberty, which again, in girls are things like breast growth, vaginal discharge, having a really big growth spurt, or in boys, testicular enlargement. Again, that growth spurt. A voice change is the kind of the ending phase. If you're waiting for that, you're kind of like towards the end of puberty. Those are true signs of puberty and really shouldn't start before age 8 in girls or before age 9 in boys, with the caveat that there's actually a sizable portion of the population, especially in girls, that does start with a little bit of breast development prior. And that can kind of be classified differently as something called benign premature telarchy, can happen in toddlers, can even happen in 5, 6-year-olds. But I would still say that's something that you would not want to try to diagnose yourself. If you're seeing breast growth in a kid less than the age of 8 in a girl, then you probably should at least bring it up with the provider and see if they think you need further workup.
And with that, so you already brought up the body odor because I have so many parents coming in at like that 7, 8, or even 9, like worried that that body odor alone means that their child is going through puberty. So now, knowing what you'd mentioned. So just say a family they notice breast buds in their 8-year-old and they come into the pediatrician and there's no other signs, right? Meaning this is obviously, let's say a female, there's no pubic hair and the height growth is looking good. Is there anything that needs to be done at that point for just, the start of some breast buds?
So I would first ask the question as to when other family members went into puberty
Mm.
because 8 is a perfectly normal time to have breast buds. And to be fair, there has been a shift in the timing of breast buds, even in recent years, to be a little bit younger. So if mom didn't remember getting them until she was 10 and her daughter's getting them at 8, it's probably normal because again, 8 is kind of like the lower limit of normal. And again, we see a lot even before that that may be considered normal as well. So generally, there wouldn't be anything to do other than to have a discussion with the family about how long like this should take to progress, because I think that what's embedded in the fear when they bring them is not, oh my gosh, my 8-year-old has breast buds, but oh my gosh, my 8-year-old's turning into a woman tomorrow, is going to stop growing in 2 inches from her current height, and is going to get her period on Wednesday. And really, there has been a shift in periods occurring earlier over time, although the shift has not been quite as dramatic as the shift in breast budding. So, if anything, puberty is kind of taking longer. It's starting a little earlier. It's starting a lot earlier. It's ending a little earlier. And honestly, my rule of thumb is usually somewhere between 2 and 3 years from the onset of noticeable breast buds to the period. And I've seen it take a lot longer than that in some cases. So for me, if I saw a patient that was just 8 years old and just starting to have breast buds, I would discuss that that is normal. And here's what you can expect going forward. And here would be some concerning things to watch for.
So, some definitions to get off the bat. So, under 8 years of age, a sign of breast buds or a sign of breast buds or pubic hair would be something that a parent should bring concern to their pediatrician.
Yeah, again, pubic hair can be tricky because it
Yeah.
can just be from the adrenal glands, but I
Yeah.
think that would warrant having the pediatrician take a look at the growth chart, take a look to see if there's testicular enlargement if it's a boy, because that is not something you're going to want to try to figure out if your child has necessarily on your own. It could be fairly subtle. And believe it or not, as endocrinologists, we actually have standards to look to see, okay, is the size reaching kind of the threshold where we can see if this is true puberty. And true puberty in a boy before the age of 9, or even right at the age of 9, would spark a little bit more concern because in boys, especially, it's not even just the thought of the puberty that's concerning. But one of the reasons we care about these things is that in some cases, it can be a sign of an underlying problem. In worst cases, and not trying to be alarmist, because this is not usually the answer, but like something
Yeah.
like a tumor. And we just want to
Right.
make sure that it's not the case.
No, so I think, when I hear online is like a lot of people are worried about girls' puberty being earlier. And I think it's because of the menstruation starting earlier, right? So is there an age threshold that is considered by definition to considered obviously like premature to start menstruation?
Yeah, I mean, anything prior to age 10 is definitely considered early. And we'll talk about, I don't know if you want me to get into it
Yeah.
now, but there are treatments that you would consider if someone is starting puberty so early that you expect that they might have menstruation by age 9, or in that kind of rare case where a child comes to you at age 9 and the parents were kind of caught by surprise that they're already menstruating. I mean, that kind of situation would deserve a full workup to figure out, why this is the case, to understand the timing of this puberty. Again, family history is so important here because if the mom says, "Oh, I also had my period at 9 and so did my mom," the
Yeah.
grandmom, then you're a little bit less concerned, but that is quite young. So, it's the kind of thing where you'd want to send labs and perhaps even consider things like imaging. And then there are medications that we use that can be used to block true puberty. I want to emphasize true puberty because, again, if it's only the adrenal glands that have woken up, there actually really aren't medicines to fix that unless it's like a rare adrenal disorder. But I would kind of put that into another category. The run of the mill adrenal glands waking up at 6, 7, 8, and it's just the pubic hair or the odor, and you've gotten the labs checked and they're not scary through the roof or anything, there's really not a way to treat that except for reassurance. But the true puberty, the period starting at age 9 or even before that, definitely there are treatment options available. And for the most part, they all work the same way by shutting off those hormones in the brain. That's again why they don't work for adrenarche. They don't work on the adrenal hormones, but they will quiet down the LH and the FSH coming from the pituitary, and therefore the ovaries or testicles will no longer get the signal to make more hormone, and they kind of turn everything off at the source. They are either injectables. They used to be monthly, which was really hard for patients. It's a big IM injection, so it would have to be done in the office. And these people would have to come in every month. But now there are options for
That's
6-month injections, which is awesome. And then there's also an implant, which can be left in for a year. And then off label, you can even leave it in for a little bit longer than that in some cases. So just some really more convenient treatment options for patients who need it.
And we are gonna get into, like, why we may see early puberty, and I love that you
Yes.
talked about treatment, because I think a question that might come up for a lot of our listeners is, why can't we just let it happen early? What is the reason for treating? And maybe people don't understand that. Yeah.
Yeah, so there's 2 reasons as I see it to treat early puberty. And I'm not saying to always treat it because
Yeah.
actually 2 considerations to make. The first one is height. Now, interestingly, the medicines that block puberty don't necessarily protect height if the kid is already kind of borderline age. Meaning, if
Mm,
you have a 10-year-old maybe who just started right before age 8 and they're already 9 and a half, and you think they're about to get their period, treating a child of that age, there may not be much of a height protection effect of treating that child. However, a child that is quite young is 5 years old and is having significant breast development, 6 years old having, a lot of progression, that kind of child would probably have a significant growth spurt that would end early if they were not treated. And by slowing things down for several years, you can get a higher, taller height outcome and
yeah.
prevent them from ending up stopping growth really prematurely. So that is one reason. And then the other reason is much more psychosocial, meaning it is hard to look very different from your peers. I know it hurts on both ends, honestly. I
Yeah.
have patients that are very late through puberty and patients that are very early through puberty, and both of them are like, oh, why can't I just be closer to normal? So, it's just tough on these kids. And then the act of actually having a menstrual cycle for a kid that isn't old enough to really understand it or, be hygienic with it can be really, really difficult. And so that is another reason to potentially use these medicines to stop puberty.
Awesome. And how long are the patients usually on these for? Just kinda, like, few years
It
to get them through that
depends.
cycle? Yeah.
Yeah, so if they're really young, they can be on it for quite some time. One
Mhm.
of my youngest patients, I think, was 3 or 4 when she was diagnosed,
Oh,
and we're
wow.
just talking about when to stop it, and she's, like, 10 or 11, like, I can't 10 and a half or so, and I think we're thinking until she's 11, so that's been a lot of years of treatment. She's been really lucky in that she hasn't really I could talk about some side effects from those treatments because 'cause they're unfortunately not side effect free. I mean, they can be, but, there are potential side effects. So this patient tolerated it great, and so we're just talking about going off of it after, like, 7 years of treatment, but other times it's gonna be a lot shorter, especially if you're starting somebody, closer to maybe 8 or 9 or something like that.
I think my next question is going back to, like, what we had alluded to, is what are the more well-supported risk factors for early puberty? I know you talked a lot about family history, and then we are also seeing a lot of misinformation online, like, "Hey, we're gonna avoid this or do this," but what is actually true, and which ones are speculation or misinformation, and which one's actually fact?
Yes. So the main true variable that we 100% know for sure is obesity and sort of just the rise in BMI. And interestingly, this was thought to be positive for a while, meaning malnourished people don't go through puberty normally. So it was seen as
Mhm.
like great progress of society that, if you go back 100 years, that we've, brought the age from menarche from like 16, 17 to 12, 13 through improved nutrition. But actually, once you kind of go past improved nutrition to obesity and excess fat tissue, that can actually kind of spur things along a little bit quicker. And there's evidence to kind of suggest it's not just correlation, but something causatory there or
Mhm.
causative there. And that's more in females. In males, it's less clear. And in fact, there might be some evidence that excess body fat can slow down the progression of puberty. So it's just a little bit different. But in girls, we know that it does spur it on. And so keeping a healthy weight and body composition is one of the things that is going to make it more likely that somebody has a more normal timing of puberty. I do want to say, though, that this does not mean that every patient who goes through early puberty or true precocious puberty is overweight. I've seen
Mm.
many entirely normal weight individuals do this. I've seen people who have others in the family that were normal weight, and then I've seen people who it comes out of the blue and they were very thin or normal weight. So this is not like a you did it or causative. It's just
Yeah.
okay, we know that's one factor that can spur it along. The second is that I think has evidence but is like a little bit more fuzzy in terms of like exact dosages and exposures and things are things like BPA and
Mhm.
other plastic components and things like phthalates that are in shampoos, soaps, all the things we use. And even when you're like, well, I get BPA free, you have to be very careful with that statement because a lot of the alternatives used, things like BPAF, are probably similar to BPA, but just now it's BPA free. They're able to say it is because it's a different
Yeah.
compound to the point where, unfortunately, it's almost impossible to blanketly avoid
Yeah.
every single type of exposure. I think that this can become a point of real guilt and shame in parents where if their child does go through puberty a little bit on the early end, they're like, oh my gosh, I did something wrong. I exposed them to something toxic. Unfortunately, a lot of these compounds are in the air we breathe. They are in the cleaners that are used in every public space. Like there is a certain point where you just don't have control. There you can draw some really good boundaries for yourself, like, oh, I'm not going to microwave in plastic, or I'm going to choose to use glass dishes and metal water bottles, and I'm going to buy organic when possible. And that's great. Whatever you can do and decide to do can be helpful, but I think the idea that you're going to somehow avoid every
Yeah.
harmful exposure is simply it's one of those things where it's almost like if you did it, you'd be living in such a bubble that the side effects of that bubble would be worse than the
I was
exposure
just
itself.
I was just gonna say that. I'm like, I talk about this all the time that the anxiety is worse than the actual thing you're trying to avoid, right? Stress and anxiety over I can't touch this. My kid touched a receipt. I don't know if you heard that going around, right?
Yes.
Like thermal
Yes.
receipts. Do I want kids eating thermal receipts and touching them
No.
every day and rubbing them on their body like a tissue? Absolutely not. But I touched one the other day. My son wanted to touch one. I'm not, oh my God, he's going to get T-lark and all this stuff. But I guess, like things like, for example, tea tree oil or
Oh,
lavender.
yes.
I guess my question for you is as a endocrinologist, are there certain things that you think about to make it less stressful for you and your family living in this world that like you said that we cannot avoid everything, but we can be more just conscious for what we do know?
Well, you mentioned the two compounds that have a good amount of evidence around them, and I've actually clinically seen,
Mm.
particularly with lavender, there was a time that it was very popular to use some lice repellent sprays that had a
Ah.
lavender base, and they were real essential oils. And the interesting thing about those sprays is that you were spraying them on and they were staying on your skin. This wasn't a
Mm.
soap that you were going to wash off. This was like soaking in, and a lot of people were using them every day because, like, who wants their kid to get lice? I don't want my kid to get lice, so I get it. And honestly, the smell of lavender is lovely. So
It's so
I
lovely. That's
understand
yeah.
the desire,
Don't
but
do this to me. Yeah, yeah, yeah.
but there
Well, I
is
guess yeah.
some evidence that that compound has some similarity to estrogen, and I have seen at least one case where I do believe it was the lavender spray because when we took it away, it was a boy. He had little buds and they went away. So
Yeah.
great. And there's some papers talking about this. There's also some people who don't believe the evidence is very strong. I feel like there are enough other remedies for lice and stuff out there that I personally just feel like if you just avoid the pure essential oils of those two oils, tea tree and lavender, I honestly don't think there's probably real lavender in like the Aveeno
Yeah,
lavender
or like
scented.
the honest baby,
Yes.
like I mean, again, this is not but like we used the honest baby lavender for a while. And to your point, I told myself, I was like, you know what? I don't have to have it be lavender, kind of what you said, right? Like there's 10 other scents I could choose from. So
The
like,
sweet almond
let
is
me,
lovely.
yeah, exactly. So we went to the sweet almond, right? And I said to myself, and I'm like, Do I need to really do this knowing that there may be a small chance? And so it's kind of one of those things that I don't regret using the lavender for however long we used it, but my postpartum brain forgot to think about like, oh yeah, lavender has that maybe questionable, interaction. And I'm not even worried that it's true lavender in this thing, but like you said, I think the essential oils, the active tea tree oil for the developing, pre-pubertal body is something to consider. And I, again, do not lose sleep, but I just think it's reasonable to look at if you have other options that are smell good, and lavender can just take a little back seat for a little bit. Yeah.
Exactly. And this is not even to say that like essential oils in general are bad, just
Yeah.
those two in particular. And then if you're knowledgeable and you're getting purely sourced oils, go for it with the rest of the stuff. So, yeah, those two in particular. And then yeah, I think just deciding which boundaries are the most important to you. I
Yeah.
mean, I gave examples, but those happen to be some of the ones that I use. Like I
Yeah.
really just don't give my kids plastic containers for school lunches. I definitely don't microwave in plastic. We love those glass Pyrex containers and
Love
things
those.
like that. The water bottles, if I can get metal, I prefer that. So you decide kind of what makes the most sense to you and where you want your boundaries to be. And you can always reevaluate that every once in a while as new evidence comes out. But make those boundaries things that will not make you crazy. I have a friend who I don't know if there's a lot of evidence behind this or not, but she does not want to use the microwave for anything. And for her, it doesn't bother her. For me, my head would explode. So, like, again, we all have to decide where we're going to draw our individual lines.
Yeah, I mean, there was some stuff about certain air fryers and things like that, and I'm like, "Listen, this air fryer is sorcery," and for me and my family, it makes sense to occasionally use the air fryer for things versus, eliminating it completely. And what I warn families about is falling into the extreme on either side, right? Like not caring at all and saying, "I'm just gonna eat and touch everything, it doesn't matter," or the extreme of like, "Well, everything's a threat," because both of those are not are not safe for the family, right? And so that middle ground, which is I know what you're doing, what I'm doing, of this sort of balanced approach of I can only control what I can control, and this is what makes sense for my family, my resources, my money, what I want to choose. My brain is spending time on is really important.
Yes. And in terms of things like Wi-Fi signals and
Oh
stuff
my
like that,
gosh, yes.
there's a lot of speculative stuff out there. Listen, are screens wonderful and is having another reason to do less of them maybe fine? Sure. But like I I don't think there's anything, causative that's been proven. So I don't think this in particular, unless you're using the indirect link of more
Yes.
screens equals obesity equals early puberty, if you're using it that way, then maybe, but otherwise, I would not drive yourself crazy on, I let my kids watch Bluey and now they're in puberty.
Well, I mean, that's what's happening on social, and that's kinda why I
Yes.
wanted to have this conversation with you, is that there is a extremism of, like EMF and, whether it's from phones or, like the plastic and, like, how they don't "I'll never do this, and I'll never do this," and I think I tend to try to not use those never words because, like, you talk about the plastic and, obviously, I don't warm plastic in the microwave, but sometimes my mom has plastic Tupperware and I may have to use it, but does that mean it's the norm that we do? No. I'm Pyrex obsessed as well. And then now there's information that Pyrex isn't good. And I'm like, everything is someone is always going to come up with something. And then also those news headlines will also make it seem like everything's a threat, like
Yes.
forever chemicals in our body, or like, saying those kind of things like plastics live forever. And it's like, I get it, but then we're not gonna consume anything and we're not gonna breathe air. Like, what do we want here? Like, you cannot live in a bubble. Like, it's true.
Yeah, and there would be downsides even if you could.
Well,
That's
I love this because I think that you knew this. I have a really good friend who's a pediatric endocrinologist as well,
Oh,
in
yes.
in
I
another
love
state,
her. Yes.
and yeah, and she and I have spoken about this as well. And I asked her about the lavender and tea tree, and same concept. She was like, "Listen, I there's other options, so why do I need to use that? If I used it and if I went to my mom's house and I had it, am I gonna have like a big meltdown? No, like it's not the end of the world, but in our home, there are other options. And that is why I think you and myself are not losing sleep when we get these headlines come in of like, oh my God, now this is an endocrine disruptor. And this is that we are understanding that, hey, we're gonna follow this evidence. I go to my endocrinologist. I'm like, what are y'all seeing? Tell me. what should I know? And I will report back to you all if I find anything that is coming back that is like a true harm across the board in high volumes.
And I think there's also you mentioned something about like, delaying puberty being a flex, okay?
Yes.
And I do feel like that's just like a marker of our society right now, right? Like anything could be taken to some extreme and like I can do it more and that's what's going to get the most views and therefore that's what's going to it kind of gets more and more
Yes.
extreme. Thankfully, I don't feel like I've seen that too much in my office, like someone coming in and being like, "Okay, I know it's normal for my kid to having breasts at 11, but like I want him to be 14 or something." I haven't seen that yet, but I guess we do have to yeah, gain an appreciation for the fact that there are major genetic differences here, and some of this is going to be beyond our control. I'm not talking about letting a 6-year-old go through puberty naturally without intervention
Yes.
or anything like that, but a child that maybe starts at 9 and has their period at 11 isn't like worse than some equivalent child who starts at 11 and has their period at 14. And actually, socially, that second kid might feel more left out than the first kid. So I guess I would just maintain perspective here. I think that's the key word. And obviously that's kind of true with so many things in parenting, right? That
Yeah,
like
yeah.
there's no winning the puberty game.
Right, and I think to your point, a lot of those videos will say, that here's what I'm doing to, to delay my kid's puberty, but in reality, it's like them saying like they're avoiding plastics or they're avoiding, what we talked about, right? Like the maybe lavender, fine. Yes, to some degree that makes sense, but I love that we're talking about what the evidence does have and what we don't have. And then a lot of them are trying to sell some sort of course or some sort of like follow my what I'm doing by commenting ebook, and it's like a $19 ebook, and I'm like, you don't need an ebook for this information. Like, here's this episode that we're going to talk about. And one of my final questions for you is like, so what do we do from here, But, the next question I have is, you mentioned about obesity, but then you also talked about like fat, right? Like excess fat. Is there a reason why excess fat in particular? Because I know it's not just about BMI, because some kids can just be muscular, like we have some certain ethnicity, but is there a reason why fat can speed this up if maybe someone doesn't understand that physiology?
Yes, it's actually a leptin link here.
Yeah.
So it is not actually pounds or BMI that matters here. It is more of a body composition thing, which is
Mhm.
actually why a quote normal weight like gymnast, they may be normal weight, but they do not have very much body fat, is more likely to have delayed puberty because their leptin levels are
Yeah.
going to be
Mhm.
very low. And leptin acts on the hypothalamus to kind of start the sort of chain reaction that then leads to these pulses of the LH and FSH stimulating the ovaries and testicles, like I talked about. And so when those leptin levels are very high, that can kind of kick the machine into gear early. And when those leptin levels are very low, that can prevent the machine from going into gear at a normal time. So you're right. It's not about actual weight. There used to be some crazy myth that was like, when your kid is 100 pounds, they will get their
Yes,
period.
I know. That's not
And
true.
that
Yeah.
is not a thing. I mean, and also 100 pounds can look very, very different in a very short child or a very tall, athletic child, etc. There probably is more truth to the idea that a certain amount of fat mass is necessary in order for most bodies to kickstart into true puberty.
Oh, but I love that. Thank you so much for explaining that, because again, we like to get into science here, and I love how you talked about the alternative, which was low body fat composition and delayed puberty in some gymnasts or other athletes as well, which we could get into a whole other conversation about that. This is such a great conversation. And I know you already talked about some of the treatments, and I think that's a great. We don't need to go into so much detail on that. In terms of, I want to just kind of re-summarize for everyone listening. So if they see their child, when should they bring up a concern, or more so, how do they communicate the concerns if their child is more private about things, right? I know at the pediatrician, I do, talk to the family about how I'm just checking boobs and pubes. Let's talk like, but I don't say that. But I'm checking the breast area, I'm checking the pubic area just to see if there's any signs of early puberty. But how can a parent kind of approach that if their child is more private, to know if they need to bring a child in for anything that's happening prematurely?
Yeah, and it's interesting because I feel like most of the referrals I get for early puberty are after pediatrician visits.
That makes
So
sense
this is
and good. Maybe
not
we're doing our job.
something
Yeah,
most parents like
yeah.
uncover on their own. And I think kids, when they start seeing changes to their body, unfortunately, that tends to be when they become the most private about it. Like, oh, I have a change, and I instinctively like, therefore now I'm using my towel and I'm not like running around the house naked. I mean, that varies. Some kids are actually not shy at all and they do not
Yeah.
mind showing. So this is very individual. But um, I would say definitely at the pediatrician visits, make sure it's checked because every office is different. And I have heard stories where people's not at your office, Dr. Mona,
Yeah.
like that would never happen with you, but like at other places, sometimes people are not thoroughly examined. And
Yeah.
even a 6 or 5-year-old should be examined because, otherwise you might never see certain things. So make sure they are checked at their doctor visits. And then otherwise look for, subtle signs. In girls, I think it's easier because like, at some point you might see some breast tissue. And if you're worried about it, get it get it looked at, especially if it's prior to age 8. If a kid is of like a bigger build or carrying a little bit of excess fat tissue, it can actually be very hard to tell what's the difference between what we call lipomastia, which is just a little extra fatty tissue in that area, versus true puberty. But you can always have it looked at, and then the provider can then like look for other signs and see whether there's a concern or not. Um, in boys, it can be really difficult, but I would
Yeah.
say if you are noticing like early acne, significant amount of acne or like body hair or something like that, it's always a good idea to bring it up because I think it's not something you're going to want to excavate on your own at home to check out their testicular volume. But if
Yeah,
it were
exactly.
happening early, you
Yeah.
would want to know about that. And it's funny that like so much of the panic is about girls because I think sometimes in boys it can be scarier. Number one, because it's like less likely to be something benign. And number two, and this is very sexist, but a lot of people worry more about their boy's height than their girl's height.
Yeah.
So
No,
you
it's
don't,
it's valid. Yeah,
you
it's
know,
true. I hear it a lot.
so I think if you're worried, then to have them, formally checked to see if they're in puberty early is a good idea. And then if it turns out, it's just a couple of hairs, then it might not be anything to worry about. But I think this segues nicely into like what would the workup potentially look like. And a lot of pediatricians would actually start things by maybe ordering a bone age. And what a bone age is it's an x-ray of the child's left hand. I don't know why it's left versus right. It's just what our standards are based on. That looks to see how mature the bones look. And this is interesting because patients always think it's how big is the hand. Like, no, it's
No,
how
yeah.
fused are those bones versus how much cartilage is there, because it's actually a marker of whether there have been abnormal levels of circulating puberty type hormones, because they will make the bones look older than the kid is. This is not to get someone super panicked if their kid is 9 and the bones look 10. It's just based on historical standards, and not every kid's bones are going to exactly match their age. But that initial screen can make sure it's not wildly off from
Yeah.
their age, because if it is, I definitely would recommend seeing an endocrinologist to potentially do further lab workup. Even imaging in some cases, we'll do a MRI to look at the pituitary, or we'll look at the pelvis in girls or the testes in boys via ultrasound. Yeah, because if something is going on enough to advance the bone age significantly, we'd want to figure out what, if anything, that is.
I love a good bone age. So, like you said, like I actually never realized that it was always the left hand, and now I'm like, oh my god. And we, general pediatricians, we don't read bone ages. They're usually read by someone like an endocrinologist or someone who knows how to read them. But we get the results back, and like she said, if it's showing a mismatch between what the chronological age is of the child and if the bones are looking a lot older than the child is, then it would prompt warning. And I will be honest, I have picked up a handful of concerns when I'm looking at early puberty, which goes back to that point of why I do believe that it's so important that a pediatrician is checking down there, because and the breast area as well as the pubic area, because also online there's also big movement. Why is my pediatrician checking my kids' genitalia? Like, why? What do they need to check for? And I went on some threads and I was like, here's why. Like, I'm going to tell you, because if your child is now taking showers on their own and you're not doing their bath time, I have seen early puberty that you have missed, and that's our job. That's nothing more. And I'm like, there's always consent there, right? The whole thing about kids should have consent and all of that. And I've had some parents sometimes refuse, or the child refuse, and I document, but there's a benefit versus anything more than that, right? I mean, we are just making sure it's not that long. It doesn't take me long now, having done this for 10 years, to check the genitalia and check the breast area and move on. And we didn't talk about that, but we look for Tanner staging, which is kind of the level of puberty, a child is going through, which I think is not needed to kind of dive into in this conversation, but it's important as medical professionals that we can stage your child as to where they are in their pubertal development, which is how we kind of gauge, okay, where are they at in this puberty landscape?
It's as important as the growth chart.
Yes.
It's sort of a vital sign in some ways, especially in the older age range, but even in the young, I mean, I don't want to fear monger, but like every so often it is something concerning underlying,
Yeah.
whether it's an adrenal disorder or, very rarely a tumor that's
Yeah.
producing hormone. And it is something that should be checked. Now, I definitely agree with making sure there's consent, and the parent should kind of I like the
Yes.
parent to be as actively involved,
Oh,
especially when
yeah.
the kid is younger, like, look with me, you know what I mean?
Yes.
Like,
Yes.
when they're older, then it's kind of more up to the parent and the patient, but I want the parent in the room. There are all kinds of practices you can have around this, but, as much as, it would, of course, be more comfortable for everyone to skip this part, but it's actually health-wise really important.
Yeah. And I have one last question for you if this is real. So I think in residency medical school, I can't remember when we learned this sort of kind of simple way to remember the flow of how things happen in puberty. And I think it's boobs, pubes, flow, grow. Have you heard of this? Is this something that is
Well, that
popular in
is not
endocrine?
a good order because you definitely don't grow after you flow. So
Oh no, grow, flow. Sorry. Boobs, pubes, grow, flow. Like you have a nice growth spurt and then you flow. Is that legit in some ways? So
in
yeah,
some ways. So
grow, flow. I mean,
this
obviously
is
there's nuances there. Yeah.
yes. In girls, usually you see the breast buds. And then
Yes.
actually, I feel like the hair is super variable and
Yes.
also very much dependent on how hairy the family is.
Yeah,
So
like
if
just
you have
by
a family
density.
that's just like
Mhm.
not hairy, the hair might be like almost like after the period or like really late. Like
Yeah.
the hair is, I almost tell them I don't care as much about the hair, like past a certain point. So I'm like, it's going to be there or it's not. But yes, definitely boobs grow, flow. And in
Yes.
boys, there's no boobs. Well,
Yeah.
that's actually not totally true because actually a very high proportion of boys in early to mid puberty get a little bit of breast bud enlargement that then goes away in later puberty. So just a little announcement of that. But in boys, they really grow in the mid to late phases of puberty, which I
Mhm.
also think is important for people to know because there's a lot of panic of my kid has 2 pubic hairs and why aren't they growth spurting? Well, they're
Yeah,
actually not
yeah.
supposed to in a boy. That spurt comes in 10 or 3, 4, and even like into 5 versus girls, it's coming like right after the breast bud after 2. So
It's why
that's,
all the junior high girls are, like,
oh,
taller
yes.
than the boys, and then all of a sudden in high school, you're like, "Oh, flip the script." Like, that's literally just puberty in mind. I love it. So, yeah, we'll nix the pubes, but we can say boobs, grow, flow, because it is. And what we mean by grow, you still have some growth, obviously, after the
You
puberty,
do
but it's not the same
after the
like,
puberty.
there's a very big growth velocity that happens before getting the period. Yeah.
Correct.
Very cool. Oh, well, I loved learning from you about my old lingo that I've learned. And where can everyone go to stay connected? And I know you have a book coming out that has nothing to do with endocrinology, but tell us more about that and where people can go to stay connected.
Yes, I know. I have my like your career is like so like
Same.
singular
Oh,
and
yeah,
mine
yeah,
is
true.
like very, very like divergent. But
Yeah.
so I mean you can see me as a patient if you live in South Florida. I'm at Joe DiMaggio Children's Hospital and practice pediatric endocrinology. And then I also have a website. It's like an old school website. It's got my name in it. It's the SHU, which is my initials, box.com. So theshoebox.com. I have a newsletter you can subscribe to there. And then I have the 2 podcasts, Best Laid Plans and Best of Both Worlds. And I have a book coming out in December, which is about how to plan your life or the method that I love to teach people to use to plan their lives called Best Laid Plans, a simple system for planning the life that you love, which again is out in December, basically wherever you can find books and super excited.
Always a pleasure. Did you know that Taylor Swift was at Joe DiMaggio? Were you there when she was?
I was extremely devastated. I was on the top of a mountain in New Hampshire and my friend texted me and I like died. So yeah.
Oh my gosh, yes. I know this episode might be coming out way, after she was there, but I some of my residents met her and got pictures and I'm like and she just brought so much joy. Anyways, we work at that hospital. I mean, there's no surprise there because I've said that before, but yes, I'm very proud of her for going to this hospital. She could have, it just seems like Hollywood is not really on the map. Like Joe DiMaggio Children's Hospital is not like
It is
UCLA.
now.
It is now because Taylor took herself there. I mean, it was so awesome. But this is such a pleasure. Everyone tuning in, I hope you learned something. You must have because this is information that is not always readily available at your pediatrician's office or in any parenting book. So if you love this conversation, make sure you give it a thumbs up sign. Make sure you're subscribed to this channel so that you don't miss any videos coming your way. And most importantly, share it with others because that is how the show and this channel continues to grow. And I cannot wait to chat with another guest next time.